Golf is a game that you can play at any age, but in order to play over a long period of time, you need to use the proper technique.
The golf swing is a very complex biomechanical motion. It involves torque, which is a twisting. It involves translation of your weight from one side to the other, and a big rotation about your spine. So it really stresses each of the structures within the spine, including especially the disc. So even with perfect technique, it's the conditions on a golf course with wet leaves and wet grass, or you're standing in a sand trap, or your feet are not at the same level. It's very easy to take your structures beyond what God designed them to, and ultimately end up injured.
Dr. Dante Implicito is an orthopedic spine surgeon and the chief of spine surgery at Hackensack University Medical Center. He treats all manners of back injuries in the spine, from the base of the brain to the tip of the tailbone. From time to time, he'll see herniated discs resulting from golf, but the most common golf-related injury is muscular sprains and strains, generally from improper swing mechanics.
So as he comes back like this, he's really loading up the facet joints in the lower spine excessively, and as he rotates through, he's transferring that weight forward and then loading the facet joints again like this. And this is a setup for injury. This is the way I was taught to swing a golf club when I was a young child, and the thinking has really changed. Another area begins at the very beginning of the swing, where this is what we call an appropriate athletic setup. His weight is centered, and his back is nice and flat. When one of the most common errors in amateur or high handicap golfers is you will see an excess arching of the back like this, which limits your turn, impacting your golf swing in a negative fashion, but this also will put undue stress on the muscles, ligaments, and discs in your low back. So keeping his weight centered not only on the takeaway where he had, and keeping, inside his right foot. He's rotating around a stable spine angle here as he comes back, and then comes up and finishes through up over his front foot like this, eliminating the hyperextension, and much safer for someone with a healthy spine, and especially more safer for somebody with an injured spine.
At Greenhouse Golf in Waldwick, they use state-of-the-art technology to track a golfer's balance, posture, and club speed. Dr. Implicito has teamed up with Greenhouse Golf and PGA Tour fitness pro Scott Riehl to run their Teeing Off on Back Pain program, in which they use data from the 3D motion cameras to fine-tune swing mechanics.
The goal is to actually help golfers biomechanically be better, so that they avoid back pain and all the symptoms thereof. Part of what we do is we do a thorough evaluation on each golfer that comes in. We look at their strengths and weaknesses. We figure out where they are mobility-wise, muscular endurance-wise, and my job is to actually work with the golfer on making their bodies better, strengthening them, stabilizing them, adding mobility where necessary, looking at the biomechanics of their swing, and figuring out how we can keep them on a preventative measure from injuring themselves. The days of old where an amateur golfer would show up to the golf course and throw the driver over their shoulder and do a couple turns and tee off are long gone.
They stress the importance of flexibility, balance, and staying fit. A lot of golfers tend to skip working out during golf season and use a round of golf as their weekly exercise. According to Dr. Implicito, if you play 1 day a week, you should be spending the other 6 days getting ready by either stretching or strengthening your muscles. If you do happen to experience a serious injury, he'll work with you to formulate a treatment and exercise plan to get you back on the course as quickly as possible.
Well, I had been playing golf for a long time, and it got to the point where my back problems became so severe that I had to have surgery, and so I went to Dr. Implicito. So after the surgery, I did have a fear, as I mentioned, that I wouldn't be able to play again. But Dr. Implicito, reassured me that I would be able to, and I wouldn't always feel this way, and that I would feel better. But rehabilitation, physical therapy, and the exercise regimen that I went on, riding stationary bikes and looking at the muscles that control the golf swing, and I really focused on that, because that was really ultimately more important to me, was getting back on the course.
There are millions of golfers in the United States. Although Dr. Implicito can't help all of them, for the ones he does work with, he makes sure they are fully informed on everything they could do to avoid injury.
I'm an amateur golfer myself, so obviously my goal is to keep people playing for many, many years, something you can enjoy with your children and grandchildren.